I presented findings on total pain burden of the CONQUER trial looking at Galcanezumab. So what does total pain burden really mean? It's a very interesting concept of what are different ways we can measure how a patient is doing in clinical practice, just outside of asking them how many headache days or migraine days have they had since the last visit. We know in clinical practice that things are very different than in a clinical trial where we give them lots of sheets and make them keep calendars and call them all the time and remind them to really stay on track. But in practice, nobody's calling the patient to remind them to keep their calendar, and life really gets away from them. And for patients that have more frequent migraine, or in particular have migraine that has been more resistant to treatment, so perhaps they've had less hope, they've been in situations that have been very difficult to manage. So the idea of constantly thinking about how many migraines and headache days they have is very depressing to them. That keeping a calendar or a diary or tracking their headache days isn't always a good way for them to measure how they've been doing. And instead, sometimes they want to know, okay, is this treatment going to improve my headache days? Great, but am I going to also notice a reduction in severity of migraine? Are they going to last shorter? Are they just going to be easier to treat? They ask us all of these questions, and sometimes it's hard to have an answer, but also we want to just tell them, yes, it's going to do all of that, that there's a composite way to answer that and a composite way to really follow this over time. So it's this idea of a total pain burden, and it's not a new concept. This is something that's been around for quite some time, not only in migraine, but within the pain field itself, that when you have a pain situation that's chronic, how do you measure all of the components of pain and looking at how that has improved when you've been on a treatment option over time? So it's the scale of total pain burden. I'm not going to get into how we calculate that. It is a little bit complex, but I will say that it not only takes a look at headache days, which is in frequency, a number of headache days per month, but it also takes a look at the duration of an attack and the severity of an attack itself, and makes a composite score using a calculation. And this is described in the abstract itself. And then we take a look at how the patient does and then how they do when a particular treatment is started. We took a look at this in Galcanezumab for some of the pivotal trials for Evolve-1 and Evolve-2 and in Regain. And then we wanted to take a look in CONQUER. So the CONQUER trial is a trial where we're looking at patients who have been considered more refractory to care. These are patients that have both episodic and chronic migraine that maybe have been on treatment options in the past, different preventive options, and have found them to be ineffective. So generally have tried 2 to 4 preventive treatment categories in the past and have not found them effective for prevention. In clinical practice, these patients, these are the ones that we really are looking very carefully in finding a good preventive treatment option for. Sometimes these are the patients that are going to be the first to try a CGRP monoclonal antibody or new treatment option, because they're the first ones that are going to come in and say, I really don't care what side effect the treatment has. I don't care about long-term safety. I'm desperate to try to feel better and be more functional. So these are really the patients that are going to be the first to try new treatment options, but also going to be the ones that we really want to see good treatment options coming to light. So there's a CONQUER trial that evaluated these patients. Interestingly, the trial found that Galcanezumab was just as effective as it is for patients who had never been on prevention before or who had tried one preventive option in the past. Also interesting, we really did notice that placebo was a lot less in these patients, meaning their idea of hope was really diminished. They really weren't believing anything was going to be effective. So they didn't come in with these preconceived notions. And I think that we're seeing this across the board in trials looking at migraine treatment, that those who had tried prior preventive treatments really have a lower placebo. And this is going to change the way we design clinical trials in the future, and already has. It's making us think that perhaps we should have a higher number of patients who have been refractory to other treatment options coming into treatment trials. And this, I think, is a fantastic thing, because again, when you bring a new treatment option to clinical practice, it's going to be your more refractory patients that need these new treatment options. They're going to be first in line to get the new treatment options. So having data in these patients is important. So we took a look at this total pain burden in patients in the CONQUER trial, and again saw that total pain burden was reduced in patients who were treated with galcanezumab compared to those that were treated with placebo. And we noticed that, yes, of course, when you're treated with galcanezumab, we know that the number of headache days is reduced. We already have seen that in the pivotal trials. We know this in the CONQUER trials. So then we did the recalculation and said, okay, is it just the headache days that makes up the bulk of this reduction in total pain burden? No, it turns out that even if you adjust for the number of headache days reduced, the total pain burden still goes down. So there is an influence on pain severity, an influence on the duration of the migraine attack. So we know as a whole, both of these are getting better as well. So it's overall very good news for patients on this type of preventive treatment that their global improvement is there. And that's what our patients really want to know about their prevention. Great that the headache days gets better, but that the duration of the attack and the severity can improve as well. And overall, that's why they're coming in saying, I just feel better. And that's really what it's translating to.